Welcome to RUMC Vital Signs. My name is Alex Lutz. On our show, you'll meet the fantastic people who make Richmond University Medical Center thrive. RUMC is an award-winning, full-service hospital located right here on Staten Island at 355 Bard Avenue. To learn more about the full array of services provided at RUMC, visit www.rumcsi.org. We're joined today once again by Ileana Costa, Program Director at the Silberstein Clinic, which is located at 1130 South Avenue. Thanks for joining us again, Ileana.
Thank you for having me again.
When you were on last time, we talked a lot about the opioid epidemic here on Staten Island, and we touched a little bit on the Silberstein Clinic. So I'd like you to spend some time telling us a little bit more about the critically important programs that the Silberstein Clinic is providing to our community.
Sure. So as I mentioned before, the Silberstein Clinic is an outpatient clinic, and we serve individuals who are 18 and older, struggling with substance use and co-occurring mental health disorders. And as I also always tell people that very rarely do we see the substance use occur in isolation. Usually our clients are also dealing with depression, anxiety, PTSD, even psychosis, and sometimes drugs may induce psychiatric symptoms as well, so we have to rule that out. And I gave a few examples before too, substance-induced psychosis, people who are using cocaine. It may obviously cause rapid speech, symptoms that appear to be symptoms of bipolar disorder, people who use marijuana may become lethargic, may feel depressed. So it's important for us to rule out that so that we can treat the psychiatric disorder.
So you're actually treating multiple issues in some individuals, and I know the Silberstein Clinic is located in the Center for Integrative Medicine. So you're actually providing medical, physicals and things like that in addition to treatment for substance use, correct?
That's correct, yeah. And one of the things we pride ourselves on is that we have done a really great job at integrating medical service in a behavioral health setting. You cannot treat one and ignore the other, right? A lot of times medical symptoms may mimic psychiatric disorders, right? So if you hear someone complaining that they have tightness in chest, difficulty breathing, shortness of breath, what does that sound like? That they're having
a heart attack or something like that.
Right. In psychiatric, they may, it sounds like, oh, I'm having a panic attack, anxiety, but it could also mean that they're an actual medical emergency, something very serious. And also prolonged substance use can lead to serious health issues, right? So we have to, for example, someone who drinks alcohol for years may develop cirrhosis of the liver. And so it is very important for us when treating clients with substance use disorder to integrate medical services. And even if the client has their own primary care doctor, we still complete our own health assessment. We encourage collaboration, right, with our psychiatrist and their primary care doctor in case there is an interaction between the psychiatric medications and their medical medication. Just in general, I mean, we're an extra set of eyes if they have their own primary care doctor, but a lot of times we see clients who don't have a primary care doctor, believe it or not, and so they can see we have a full-time family nurse practitioner who can treat clients. We draw blood on site so we can do routine blood work for our clients. For women, we encourage them to obviously follow up with their OBGYN, routine blood work, making sure they're taking their medication for any medical conditions. Yes, so integrated,
all under one roof.
Right, and that's a great point because there are so many benefits of being able to go to one place where not only can you get treatment for your, substance use, behavioral health issues, but also your medical conditions.
And do you find that people who are substance users tend to neglect their health?
Yes, that's a great point. For years, we see clients that haven't had a visit with their doctor, and when they come to Silberstein and they meet with our family nurse practitioner, it may be the first time, in years that they've seen a medical professional.
And how does someone access the services of the Silberstein Clinic?
You can simply call, so you don't have to be referred by rehab or a special entity. You can simply call yourself, and the phone number is 718-818-6970.
So tell us a little bit about the staff of the Silberstein Clinic.
So we have 6 clinicians on staff. We have a full-time psychiatrist, a full-time family nurse practitioner, a registered nurse, and a certified peer advocate. We treat over 350 clients at the Silberstein Clinic. We are licensed by the Office of Addiction Services and Support, OASIS, and we are contracted through the Department of Health and Mental Hygiene.
Do you find that the clients are coming from all over Staten Island, or is it particular neighborhoods, particular ages, demographics?
All over, yeah.
And so all over from the neighborhoods. What about ages? Are you seeing more of a particular age, more of a particular gender?
Well, we do have a program that focuses exclusively on the treatment of adolescents and young adults between the ages of 11 and 24. But in general, I would say people of all different walks of life are coming, and people are also at different stages in their recovery. While we have some people coming in and their goal is to stop using, their goal may be to stop using altogether, while some people, that may not be where they're at. They're not ready to stop using. They may want to reduce the risks associated with their use. So we discuss different harm reduction approaches that can be utilized. So for example, for someone who is still using opiates, we have fentanyl test strips that we give to them. They can actually test their drug for the presence of fentanyl. As we learned about in the other show, fentanyl is causing overdoses.
Right.
It's very highly potent. And so we do that. We also give Narcan, which I'll demonstrate how to use later, but different harm reduction approaches, because most overdoses are occurring in private residences. We talk about never using alone. So this is for people, again, who are actively using and are having a hard time, because relapse is part of recovery. Even if someone comes in with the best intentions to stop using, they may relapse. And so we have to understand that and meet the client where they're at and have an open conversation about what, if they are still using, what we can do to reduce the risks. So we talk about never using alone, having Narcan, and we involve family members too and loved ones, and have them come in and get a kit, because what good is it for me to have the kit if I'm the user, and I'm overdosing? I need to make sure that people around me have the kit. So we stress the importance of that, and not mixing drugs, right? Using in small quantities. These are all different harm reduction approaches.
So you're offering programs not just for the individual themselves, but also their family members too.
Yes. So we do family therapy. Parents are often involved in the treatment. So we do a lot of psychoeducation, because a lot of times parents don't know where to turn and what to do, or spouses, and we offer services for significant others too. So you don't have to be the one that is using to access treatment. If you're dealing with, for example, a spouse and it's impacting you, you can also come and receive treatment at the clinic.
And as we're seeing the pandemic, as you said, it affected the use of opioids, and it's continuing to grow across Staten Island. I guess a frightening question that maybe you have the answer for. How young are you seeing people who are using?
So interestingly enough, not that many young people using opiates that we're seeing. But we do see it. I mean, I can tell you that the other day we were having like an overdose awareness event, and a young man was in the clinic, and he was actually looking at the kit, at a Narcan kit, and he told me in his 20s that he had already overdosed, had to be Narcan twice, only 20 years old. So I think that I think that it's underreported, right? So even though we're not seeing it at the clinic, it's an issue with teenagers are using opiates. They are dying from overdoses, and there's a lot of work that we're doing to increase awareness in schools, in high schools, and colleges, so that they can be aware of the services that we offer. And so another thing that I wanted to just mention is that we also offer medication-assisted treatment, including Suboxone, which is taken orally, Sublocade, which is a monthly injectable medication. We do oral naltrexone, and Vivitrol, which is the injectable form of naltrexone. So what is medication-assisted treatment? Specifically, Suboxone is a buprenorphine-based medication used to alleviate withdrawal symptoms, right, while reducing psychological drug cravings. Suboxone is a partial agonist, which means that it partially satisfies the brain's need for opiates, thereby eliminating like withdrawal symptoms. So Suboxone is an option for someone who wants to come off of opiates and not have to experience the withdrawal symptoms, right? Sometimes people choose to go on Suboxone and slowly titrate off of it so that they can stop, right, using opiates altogether. While others may stay on Suboxone for months and maybe even years, because for them it is keeping them from using the drug on the street illicitly, which obviously, there's risks in that, because if you're using illicitly, it could be laced with fentanyl. So Suboxone has been very effective in helping clients come off of opiates, or for clients who want to be maintained on it, it's also a very effective option. It's good for relapse prevention. And then there's also Sublocade. So Sublocade is the injectable form of it. And this is kind of a new thing that we've introduced. So instead of taking the pill every day, you receive the injection once a month. And I've heard that it is much easier to come off of the injection, than it is the oral medication. So in the clinic, we have about 25 people on Sublocade, about 15 people on Vivitrol. I didn't talk about Vivitrol yet, and about 50 people on Suboxone. So this is used pretty often in the clinic.
So, I mean, it's easy for me to sit here and I mean, obviously you're an expert in all of this, and there's so many great services available through Silberstein. But I understand the hesitancy and the reluctance of someone to say, I want to go for help. So if someone were watching this and listening to everything that you were just saying, who is making the decision that I'm going to go for help, what would you say to them?
I would say that's the first step. And I would say that at times it may feel hopeless. People hit rock bottom. There may be some shame and guilt and getting treatment for substance use, but our staff and the environment is very non-judgmental. And so I would say that, just take that first step, and we have a team of caring professionals that'll help you, through that process, no matter what the circumstances, right? And
you mentioned, obviously, overdosing. So what are some of the signs of overdosing?
Signs are unresponsiveness. So someone's not responding, they may stop breathing. You may notice that their skin is cold, their fingertips are turning blue, their lips are turning blue. So these are clear signs that they may be overdosing, right? So you want to check first that they're unresponsive. So some of the things that you can do is you can, approach them and shout in their ear. I mean, they could just be sleeping, right? So you want to, before you start initiating Narcan, you want to first make sure that they're unresponsive. So if you shout, and we're also told you can do like a sternal rub. So if they're not responding to that, it could be an emergency. It could be that they're overdosing. And so if that's the case, if they're unresponsive, administer Narcan. And so you also want to call 911, right, immediately. So if if this is happening, call 911 because you're going to want like medical attention to be
So you're calling
on their way.
911 before administering Narcan?
Maybe someone else you can tell someone else, call 911 as you're, getting the Narcan ready because you don't want to delay. So if someone else can call it while you're going.
Not to put you on the spot, but if I'm by myself, what would you suggest? Call 911 first or do the Narcan first?
Call 911 because you
Okay.
want people to start coming. And so you're going to, so I'm going to walk you through what's
Go ahead.
in here. So the kit contains 2 nasal sprays, right?
Okay.
It has gloves. This is like a face shield for rescue breathing.
Okay.
And this is like an informational flyer about what is naloxone. It's in English and Spanish, so it
Okay.
kind of goes through what we're about to go through
Okay.
here. So essentially what you do is, again, so after you determine that someone's not responsive, this works on opiates, right? So it's used to reverse an opiate overdose. So opiates, it works on fentanyl, heroin, prescription painkillers. We spoke about the different forms of opiates. This will work. So what you're going to want to do is peel it open.
Okay.
Okay. So literally they say peel, place, press, right? Because
place,
yes,
press.
it's very, very simple and there's no like assembly required. Some people wonder too, like if I use this on someone that isn't using opiates, is it going to cause harm to them? It's not going to cause any harm. So
Okay.
if you're not 100% certain that this is an opioid overdose, you can still use it. It's not going to cause any harm. So what you want to do, like I said, peel, right?
Mm-hmm.
Place in the nostril.
Okay, so this...
Yep, goes in the nostril.
Okay.
And I'm going to actually
Okay.
press. It shoots up.
Okay.
And you can't test it. So like it's one shot.
Okay.
So you don't want to let me test it out, see if it works. It's, has to be in the nostril. You press it up.
Okay.
So the person should snap out of it.
So this second one, then you don't have to administer if this first one reacts?
If this first one reacts, you don't have to use the second
Okay.
one. However, after 2 minutes, if someone is not responding, then you do want to use the second one. And use the other nostril just in case the person has a deviated septum and it didn't go through the first nostril.
Okay.
So you're going to want to, after 2 minutes, nothing, use the second one in the other nostril. And the rescue, so you can also do rescue breathing if someone's not breathing. What you're going to want to do is tilt their head, tilt their head, pinch their nose, and give them 2 rescue breaths, noticing the chest going up. And then you're going to want to continue giving a breath every 5 seconds. This is why they have the shield, the face shield. So the rescue breaths, and once the person, if they're, they're going to be in withdrawal when they come out of it. So they're not going to be comfortable. They may not be happy. They may even be embarrassed, right? So these are some things that you can expect, but this will last for about 30 to 90 minutes. So it's important. Why it is so important for medical attention to be on their way is because this will work, but if it wears off, someone can slip back into an overdose, right? And so they talk about also putting the person in a rescue position, recovery position on their side when you're not administering the Narcan or giving rescue breaths to prevent choking. But that's pretty much, it's pretty,
effective?
pretty effective and simple to use. And this is so we give these kits out to every client that comes to Silberstein, and we distribute them at various outreach events. So we offer it to, regardless of your drug of choice, we offer a Narcan kit to our clients. As I mentioned earlier too, we also involve family members. And
And you give these, there's no cost to these, right?
There's no cost. Yeah, we get them free of charge. We get them in bulk from the Department of Health and Mental Hygiene. And we also give the medical emergency room Narcan kits. So RUMC's medical ERR distributes kits. They give out anywhere from 200 to 400 kits a month to people visiting the medical emergency room in the context of opioid withdrawal or substance use. And so, yeah, this saves lives, literally. So we give them out to as many people as possible.
And community education is a big part of Silberstein Clinic. So you're actually also going into schools and community fairs, community organizations, providing this Narcan training that you just gave me.
Yes, Alex. You're always asking me. You should know better than everyone. Yes, we go to various events and give these out.
And roughly how many kits do you think you give out in a year?
Oh my God, like thousands.
Wow.
I think 5,000. I think one year we gave out like 5,000 kits.
You know, I worked at the Red Cross for 11 years, and we used to have to take CPR training. They used to give you the mouth guard, and we used to always say that the CPR training was something that you should have and hope to never use.
Yeah.
And this kind of fits the bill as well. You have it if you need it, but you hope you never have to use it.
Yes. And a lot of times that's like what people will say when they decline getting one is, oh, I'm not around opiates. Like no one I know uses opiates, but then we'll like let people know it is so widespread that you never know when you're going to need it. So I carry this around, and everyone we give it to, we encourage them to carry it around.
And how long have you been at the Silberstein Clinic?
So I've been working for RUMC for over 11 years. I started as a mental health counselor and, moved up to becoming the supervisor of the program.
So you've seen all of this happen around you, we talk a lot of times on the show to nurses and doctors, and we always say, how does it feel when you're saving lives? You're doing the same thing. You're saving lives. It's obviously a career you wanted to do, but to actually be doing it, how does it feel?
It feels like, it feels really good. I mean, I had a client who went through so much and actually just terminated, right? Because he's and that's good, right? We want our clients, but just to see what he went through. And
when you say terminated, you mean he's
graduated from the program.
Okay. Just want to make sure the terminology there.
No, but obviously we want, but it makes me so happy to see clients go from, this client in particular went from being homeless to having, issues legal issues, issues with drug use, obviously, and he is now a professional in his career, lives alone. And so, it means a lot to be in this profession and to see see the success stories.
And what do you, obviously, it's an emotional impact on you and dealing with serious subjects and serious things every day. How do you decompress? How do you, I know it's hard to you can't really turn it off, what you hear and see every day, but how do you, how do you turn it off, so to say?
I think that for me, after I leave work, one of the things I do is I exercise, so that's kind of my outlet. I have 2 young kids, so I sort of just need between everything heavy going on at work and coming home and the kids, I'm I need to take time for myself and just decompress.
But it must give you an interesting perspective on life with what you deal with.
Sure, with my own kids, I think about my gosh, I hope that, I have a son who's 4, a daughter who's 1, you obviously don't want your children to get, mixed up in drug use. And I see parents who don't know what to do. And so obviously, it makes me think about my own kids.
So no regrets on your career choice, it looks like?
No.
Well, I'm glad we had you back on the show. I think what you're doing is amazing. and you are doing a service to our community that I think a lot of people may not be aware of, and hopefully watching this episode, they're going to reach out to you, and if not go for Narcan training, come to you for services that I think are extremely vital for our community. So thank you for what you're doing.
Thank you.
Richmond University Medical Center has cared for Staten Island and the New York City metropolitan area for nearly 120 years. You can help ensure that care continues by making a financial contribution to the hospital. Donations can be made in your name, the name of a loved one, or to honor a special nurse or doctor at Richmond University Medical Center. To donate, visit our website at rumcsi.org and click on the donate button located at the top of the homepage, or you can call 718-818-2106. In the meantime, that just about does it for this episode of RUMC Vital Signs. Thanks for joining us. I'm Alex Lutz.
An opioid is a type of drug used to reduce pain. An opioid emergency happens when too much of the drug overwhelms the brain and interrupts the body's natural drive to breathe. Opioid emergencies are a fast-moving epidemic affecting people nationwide, regardless of age, gender, or location. However, negative attitudes driven by stigma may hinder one from being prepared to help save a life. People may think, "It could never happen to me," or "I don't know anyone who could overdose." But chances are, they do. And even if they don't, they can still be ready to make a difference. An opioid emergency can happen to anyone: a child, a parent, a friend. It's time to change the way we think and talk about opioid emergencies. And it starts with a simple message: you have the power to save a life. Narcan nasal spray is an emergency treatment designed to rapidly reverse the effects of a life-threatening opioid emergency. If you suspect an opioid overdose, check to see if the person will not wake up, is very sleepy, or is not breathing well. Do not test the nasal spray device before use. Narcan nasal spray is for use in the nose only and is safe to use even if opioids are not present. Hold the nasal spray device with your thumb on the bottom of the plunger. Insert the nozzle into either nostril and press the plunger firmly to give the dose. One nasal spray device contains 1 dose of medicine. Call 911 immediately after giving Narcan nasal spray. If the person does not wake up, continue to give doses every 2 to 3 minutes until the person wakes up. It is safe to keep giving doses. Stay until an ambulance arrives, even if the person wakes up. You have the power to save a life. For more information, visit Narcan.com.